On today's show, we're discussing new research on heart failure with preserved ejection fraction, or HFpEF, in people with severe obesity. This is the JAMA Medical News Podcast. I'm Associate Managing Editor Kate Schweitzer. News Director Jennifer Abbasi is here to talk about her story. Jen, thanks for joining.
Happy to be here.
So, Jen, why do you think this study, which was recently published in Science, was important enough to cover?
Well, HFpEF now accounts for half of heart failure cases, about 32 million people worldwide. Patients with the condition are hospitalized more than once a year on average, and there's a high rate of mortality. Importantly, there's been a major shift in who is presenting with HFpEF. As one heart failure expert I spoke with told me, it used to be a disease of little old ladies with hypertension and small, stiff ventricles. But over the past 2 decades, obesity has become the most common underlying comorbidity, and severe obesity increasingly is the dominant population, according to Dr. David Cass. Dr. Cass is the senior author of the new research and a professor of cardiology at Johns Hopkins School of Medicine. So understanding the underlying mechanisms in this group could help inform better therapies. That was the goal of this work, and what the findings of this study suggest is that HFpEF may be a different disease in patients with severe obesity.
The researchers looked at heart muscle cells, specifically the motor proteins in them that produce contraction of the muscle. These motor proteins are called sarcomeres. What did they find?
They found that the heart muscle cells from patients with HFpEF and severe obesity, those with BMIs around 40, had marked defects in sarcomere contractile properties when compared with patients with HFpEF who were less obese. In fact, many of the sarcomere changes in the HFpEF and severe obesity group were similar to those found in the heart muscle cells of people with late-stage heart failure with reduced ejection fraction, who were undergoing heart transplants. Now, what this demonstrates is that patients with the most severe obesity and HFpEF not only have impairment in diastolic function, but they also have profound impairment in systolic function, despite the fact that their ejection fraction is normal. So not just problems relaxing and filling, but also in contracting and pushing out blood. So this is a big shift in the understanding of heart failure with preserved ejection fraction.
But how can that be the case if their ejection fraction is normal?
Well, that's, of course, an important question that needs to be answered. One expert I spoke with suggested that in people with severe obesity, the epicardial fat may actually constrain the heart's dilation, which is a key factor in reduced ejection fraction. But this needs to be investigated more.
Okay, so where does this research go next?
Well, other findings in the study offered hints that weight loss might revert the heart muscle cell changes in people with severe obesity. But a controlled trial with before and after biopsies of the heart is needed to confirm that. Dr. Cass wants to conduct that study. The researchers also found a possible biological mechanism that may cause sarcomere dysfunction in people with HFpEF and severe obesity. And tapping into that pathway could lead to therapies that improve the ability of sarcomeres to contract. For now, though, one expert said that the study shows HFpEF truly is a heart problem, not just symptoms that are due to obesity and load, and that an important clinical implication is that physicians should have a very high index of suspicion for heart failure in patients who are severely obese and complaining of shortness of breath. Going forward, it will be important to recognize the pathophysiological diversity of HFpEF and that clinicians can't just treat everyone the same way.
Thanks, Jen. All right, if you'd like to learn more, we'll include a link to Jen's story in the show description. This week, we also published a piece on the first global report on nicotine pouches, a growing public health concern. You can find that and all of our stories at jamamedicalnews.com. Thanks to Jen Abbasi for joining me. I'm Kate Schweitzer for JAMA Medical News. This episode was produced by Daniel Morrow at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening, and join us again next week.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.